Hello, everyone. I am Alisa Brownlee. I am a home accommodations and assistive technology specialist with ALS United Mid-Atlantic, and welcome to our podcast. I am delighted today to talk to my colleague, Amanda Cuth, who is a speech language pathologist in the Lehigh Valley area. And Amanda, if you would give us just a brief bio of who you are, where you work, and what you do.
Yeah, absolutely. Hi. My name is Amanda Cuth. I'm a speech therapist. I work primarily out of the Lehigh Valley ALS Clinic, part of Jefferson Health, and I have been a speech therapist for about 11 years and with the ALS Clinic for 10 of those years.
So, just because somebody might not understand, is a speech therapist the same thing as a speech pathologist?
It is. Yes. Yep. Interchangeable terms with those. Speech language pathologist, all the same. Yep.
Okay, good. And what is your role within the clinic?
Sure. So I work with all of our patients on anything speech therapy related, speech pathology related. So whether it's language, their speech, their dysarthria, speech changes, swallowing changes, and then alternative communication as well. So I will see patients every time that they are in clinic. We see patients usually about once every 3 months, 2 to 3 months. So I will see them during that clinic visit itself, but then also in between clinics. So I am able to go to their houses, have them come in separately, one-on-one. So which helps a lot with carryover of different recommendations, but assessing all those different areas every time that I'm meeting someone or seeing them.
So, we're recording this in October of 2025. So, say you have a client that's coming in this month. You're going to see them 3 months. What are you looking for in that 3-month difference
Absolutely.
as a clinic speech pathologist?
Sure. Yep. So big one for me is how their speech, how their communication, how their voice is currently, and then over that 3-month period. So within clinic, I will do different assessments with people, informal, some a little more formalized, but just to see how their speech rate is, how their vocal quality is, if they're noticing any changes in any of those. We also myself and our clinic team give a lot of education to our families as well and the caregivers. So even if the patient isn't necessarily maybe noticing a lot of changes, but their family member is, or that communication is different at home in between those clinics, they have my contact info to reach out and to go over options. So a lot of speech changes, difficulty communicating in any way that may be, and how someone's voice is as well are the big ones for me.
So, from a physical perspective, can you tell us why these muscles get weak, or why does communication get impacted with this disease?
Sure. So yes, with ALS, so with the motor neurons and how those are impacting all of that muscle activation and strength for our tongue, our cheeks, our throat, our vocal cords, all of those different areas that, again, we never really have to think about. They're not until something has changed that we do. What's happening is those motor neurons are not activating, they're not firing, they're not able to give that strength, that coordination to those muscles. So where our tongue is typically moving in our mouth and our lips and our cheeks are moving to make different sounds and combinations of sounds, those muscles in particular, this bulbar area that we look at, are impacted, which can then lead to changes that it's not as clear, it's slurred, it's not as nasal quality to someone's voice, so it sounds like maybe there's more air coming out of their nose when they're speaking, and it's all related to how those motor neurons are firing for those muscles.
And what's the medical definition of slurred speech?
That is dysarthria. So that is a term we will use in clinic, and sometimes introducing it to people as that term and then explaining what it is as well, too.
So, can you explain the different types of dysarthria somebody might have?
So there typically, I see 2 different areas. There's spastic and then flaccid dysarthria with ALS. A lot of times people will experience combinations of both of these symptoms, but the spastic dysarthria is a little bit more with someone's strained vocal quality. So it sounds like they're hoarse, They have that harsh vocal quality. It's strained. It's not as strong as well. Whereas the flaccid dysarthria, I think that's more that weakness. There's not as much that tightness. So then that can be more of the nasal quality of someone's speech. It's how those muscles are not coordinating, and it's weaker. It's breathier. It's a lot of that volume that is really impacted with someone's voice as well.
So if somebody has some form of dysarthria, will it continue to progress?
Unfortunately, typically, yes, with ALS, it will. That being said, everyone is different levels, different stages, different progression with it, but it typically will, yes.
I've been here 30 years in March, and no two people I've ever worked with have been the
Right?
same.
No, exactly.
And so, yeah, we don't necessarily know what will happen
Sure.
with their speech. That being said, if you want to plan in advance,
Mm-hmm.
one of the things that our ALS community is doing is, prior to any voice impact, they're going to be doing voice preservation. So can you talk a little bit about that?
Absolutely. So that's definitely a big topic that I bring up at clinics and in between clinics with patients and their families. So there's voice banking and then message banking are really the two big ones that have been around for a couple years and we've talked about. And that is the concept of saving someone's voice as is into recordings and synthesized speech that can be used later if we need. And that can be used on a speech generating device. It could be used on communication apps, many, many different ways for people. We've been trying to talk to people about recording certain messages to their families, to their loved ones, maybe even that aren't necessarily going on a communication device, but just to have that, how personal your voice is, it makes it a lot different when it's your voice being used.
Yeah. There's a lot of talk about something called voice cloning. And I read an article last month. There is a woman in the United Kingdom who has ALS MND, Sarah Ezekiel. I don't know if you saw this article.
I know the name. I haven't.
Right. She lost her voice 30 years ago. And through this voice cloning, the company took like a less than 10, 15-second snippet from a VHS tape and they recreated her voice. So can you talk about what voice cloning is?
Absolutely. Yeah. So definitely new and up and coming in the world of ALS. So we've had a few patients through clinic who have gone through it and have had good results with it so far. But essentially it's the use of AI with recordings, previous recordings. It could be short snippets altogether. It could be one long speech that someone has given, but they take those recordings and create a clone of your voice from those. So it's pretty amazing what it can do and how the vocal quality is with it. But yeah, I've had some patients who have they have a speech from they are a professor or they're a teacher and they have something recorded that's a consistent length. I've also had patients who have done that. They've looked at old videos and they've looked at different things and they can separate out and will separate their voice out to use with the voice cloning. So really neat.
And that's relatively new. I mean, we've been asking for that for years. And it's an amazing technology. The other thing that I want to point out is that sometimes if there is no tape of the person with ALS, a sibling could also step in if they sound similar. And then the voice can be tweaked.
It is. Yeah. Yeah. And there's a lot of advancements in what is already on devices, I think, and the voice quality, but it's still a lot of times not that person's exact or a very close replica of their voice. So yeah, we've had the voice recording, message banking, voice banking by a family member, sibling, anyone, which is really amazing as well.
And I know people are hesitant to do this often because they don't want to think about there might be a point in time where they don't have a voice. And my colleague John Costello put it right in the right frame of mind when he said, think about it as insurance. You pay a new insurance, homeowner's car, just in case. Well, think about voice banking and message banking as a just in case.
Absolutely.
And in the past, it used to be, we had one company, it was 20 hours. Now you can voice bank in 15 minutes, 30 minutes.
Exactly.
And there's lots of different options, and we're going to have a whole different podcast just on voice banking, message banking, and AI. So for those that would like more information on that, know that that will be coming. But that is something a speech therapist or a speech pathologist in clinic will discuss often with people. And if not the speech pathologist, I've seen the doctors even say, hey, consider
Oh,
this.
yes.
And there is help out there. If you can't figure it out on your own, there is help out there for people that need the assistance. So back to some communication issues. So say somebody is having some speech issues. What can they do to obviously, let's talk about speech therapy. Is that contraindicated, indicated?
Yeah, so in the traditional sense of speech therapy, if I was seeing someone who is not an ALS patient, a lot of times that centers around a lot of repetitive exercises, movements, tasks, different things, which there's a lot of research and different things that are coming out with ALS about that, definitely. What we tend to do, and I tend to do in clinic, is more so talk about it in a compensatory strategy sense for speech therapy than a like drills, articulation, all these different exercises that we're doing, 100 times a day for someone. So it's still wanting to maintain those muscles and that are used for speech, for swallowing, for communication. So definitely from that side, speech therapy beneficial. Even more so than two, I think it's a lot of those strategies, those compensatory techniques, those different things that are both for the patient, with my patient with ALS, plus their caregivers, their loved ones, their family, because it's such a change on both sides for that communication. So that speech therapy absolutely helpful, whether it's in clinic, outpatient, in home, anything at all that someone is participating in.
So if somebody starts to have slurred speech, you mentioned compensatory strategies. Can you expand on what that means?
Absolutely. So definitely talking to people if they're noticing that their speech isn't sounding quite as clear. So if they're noticing that, oh, I have to repeat myself maybe a little bit more, or sometimes I have patients who will tell me by the end of the day or after they've talked for a while, their speech might change a little bit more. So big things I always recommend, I usually say the big three are over articulating. So thinking as if you are over enunciating every single sound, every single word, slowing down how quickly we talk. We don't realize as humans that we tend to talk pretty quickly, and also breathing support. And that goes into a lot with our respiratory and everything too, but how our posture is, how our breathing is, how we're able to take a breath before we speak can a lot of times give us some more power behind our voice as well.
And I think positioning is very important, what you
Yeah,
just said. If you're
absolutely.
leaning over, your diaphragm is going to be impacted. If you
Mhm,
get sitting up and even get your neck up,
mhm,
you can project.
mhm.
Now, there are some people who don't have necessarily slurred speech, but they have soft speech.
Yes.
Why is that?
So a lot of times that it could be due to how their breathing support is. So if they're having some shortness of breath or diaphragm or positioning too, if they're noticing, it's one of the first questions I will ask people is when their speech is primarily impacted, where are they? What time of day is it? How are they positioned? Sometimes it's that, we're in a recliner and we're leaned back or just not in the best position for speech. But a lot of times it's that our breathing is not coordinated as much, and it's that our diaphragm and our lungs and our muscles maybe aren't giving as much effort to our voice, which can make it sound softer, not as loud, quieter as well.
And a voice amplifier would usually be introduced at
Absolutely.
that time. People can
Definitely.
or cannot use it, that's their choice.
Yes. Yep.
But if you can describe what a voice amplifier
Sure.
can do for somebody with ALS.
Yeah, that is a hot topic item that goes out of our clinic all the time. I'm always giving those out. So yeah, so there's many different types. Usually I recommend one that is more of a headset that is a mouth amplifier right by someone's mouth. And what it does is I always say to people, it doesn't necessarily mean that it has to be that they are booming loud yelling with the voice amplifier, the microphone, but it takes away some of that extra work that they might have to do. So all of those things I just talked about, of the taking that breath, making sure we're over articulating, still doing those, but then also having that amplifier, it does some of that work for you. One thing I really like about them too is if they are Bluetooth with it. I have some people who their caregiver will hold the actual amplifier, the speaker part, while my patient has the microphone. It's a lot easier to communicate between rooms of the house within a range. So definitely helpful for a lot of
Yeah,
ways.
absolutely. And so what I used to hear a lot, and I still do in clinic and when I'm talking to people, is they say, I sound fine.
Yeah.
And why is that? Why do people think they sound fine, but their caregivers are going, what did you say?
Sure. Yeah. So our perception of how we sound is always usually different than, as you say, people too, how you sound on an answering machine or how in a video or something, you always feel like you sound different in your head versus how you actually hear it. And that's a hard thing for people to come to terms with, I think, for just that natural part of that as humans. How we sound, but also how someone speaking is still the same to them. It's not, those muscles may be weaker or there might be changes, but it's not sounding different. Whereas then their family is saying, I can't understand you as much, or we were having to repeat really often certain times of the day, or when we're in the car or loud environment, and there might be certain situations that are just a lot harder.
Yeah, there's a lot of research out there about the loss of communication when it comes to dealing with a sudden onset neurological disease, and there is grief involved
Absolutely.
and coping. So people with ALS need to recognize they do recognize that this is one of the things that they didn't want to ever happen with this disease. Because people will tell me all the time, "I'll take the walker. All right, I'll go in the wheelchair, but please don't tell me I'm not going to be able to verbally speak." But there are options
There
for
are.
those that cannot make their needs understood through technology. And I'm going to go back to when I started 30 years ago, the voices sounded like that. I mean, and we've come so far, and there's so many different communication systems. How does one choose?
That's a great question.
Yeah.
There are so many out there, which is, as a therapist, that's great. As a patient, it can be overwhelming, definitely. And there's so many things. So that's where coming to a clinic, seeing a therapist, seeing an AAC, assistive technology, there's so much benefit with that because having that insight of which device or which app or what it may be. So yeah, there's so many things, and that ranges from not so techy upwards of high tech options and communication tools that people have. There's even different apps that are out there for communication, and price is a big point. What they can do, how much storage they have. I always say one of the big things I talk to people about when choosing is how much can we personalize this? So if it's something, yeah, it's free, it's great, but it might run its course in a couple months after we use it. We need a little bit more storage. So there's so many things. And that's why trying a lot of options is really important as well. Even if it's something that we're like, oh, we like this piece of this one and this of this one, but we can find a middle ground of those different criterias. I usually within our clinic and within home visits and in between clinics, what I do with people is go through a checklist of different needs that they have. So what's more important, but the top priorities, right? So it might be to one person, it might be, yes, that verbal communication, having that. But to someone else, it might be, I really need to be able to use my cell phone with this and to communicate with my family next door or whatever it may be. Going through questions and getting to know someone, we can parse down a little bit more of what tools would be best, but so many options from not so techy to upwards of anything you can kind of wish for, which is good. But that's the big part too, I think, with the voice banking and message banking is when people hear one of those communication apps or tools and you hear that speech output with it, they've made advancements, but it's still not you. It's still not your own voice that your family knows, your children know, that having that option of having your recordings and your own voice is such a big impact and a lot more likely to have someone be interested in using and their family using a device or anything, communication tool as well.
Yeah, I mean, years ago, the communication devices were big and bulky, and I would have a lot of people say, I just don't want to use it because I don't like the way it sounds. We don't
Yes,
necessarily have that now if you have banked your voice because it does sound like you. And I think that has been a major change within the augmentative communication device
absolutely.
acceptance, I guess. Yeah.
And like you said, I mean, just in the 10 years that I've been doing this with the AAC and the communication piece, it's unreal. And it's such a positive way of what has come and where it's going to.
And I'm just going to say for the listening audience and the watching audience, ALS United Mid-Atlantic does have a whole podcast devoted to augmentative communication. I would encourage you to look that up. So we're not going to delve deep into it in my discussion with Amanda today, but know that it's out there. But one of the things I really want to highlight is what Amanda said. Communication can be as simple as writing with a pen and paper, and as complex as eye gaze or even brain computer interface. As a family member, you need to meet your loved one with ALS where they are. If they want to write and that's all they want to do, then you need to say, okay, because I can't tell you the number of people who have said to me, oh, my loved one, my grandfather, he's 99 and he needs, a high-end communication device. And granddad's going, no.
I don't. Yeah, I don't want it. Yeah,
Exactly. So it has to be what the person wants, not necessarily what their caregiver or their grandchild who grew up with opposable thumbs like this that can text like this, not me. But so I think that's really important for people to hear
yeah,
that they
absolutely.
that they need to. It's okay that it doesn't plug into the wall.
Exactly. Yep. Still is
And
effective, still
yeah.
does what it needs to do to communicate. And even with one of the big things I stress a lot to my people and my patients is that I have patients who, yes, are all tech and love the eye gaze and are so, so good at it. Fabulous. But if the power goes out, if
Mhm.
it doesn't charge, if we just something glitched and we have to, whatever it may be, still having those other tools, those quick tools is still really important too. So I have some people who, yes, they have their communication device at home, but when they come into clinic or they are out and about, they have their writing pad, they have their boogie board, they have their communication boards too. So yeah, it's all around and many an option that we're talking about.
And I think those of us that educate our families about communication, we need to focus on that there are many different communication environments,
Mm-hmm.
like you just said,
Yep.
because
Yep.
if somebody is on the commode, they're not using their communication, their eye
Exactly.
gaze. All right,
Yes.
so you need to teach them how to communicate when they're in the bathroom, how to communicate when they're in bed, because again, their device is probably not there. It's important for us as educators to let our families know, but also for the families to know that you will be communicating in different environments and you're going to need different communication strategies, because I sometimes feel like, oh, I've got this $17,000 device and it's going to suit everything,
Everything.
and it doesn't.
No, no, yeah, and they're phenomenal at what they do, but yeah, in every situation, it's not 100% guarantee for every situation or environment, and that's where even something as to us, I think coming into this, we don't think about it too of an eye blink, a gesture, facial expression. And I have so many people that will say they've been married or they've been together or, have known each other for 25, 30 plus years. And they're like, yeah, with one look of their face, I know what they want, right? But even having those for those other caregivers, when you're on the commode, when you're in bed and you can have a system that is not any technology at all, but is blink of the eye a certain way, a certain movement of what that response is. So, and going over all of those things with patients is good too. So, a lot of options.
Absolutely. And one of the most important things that I stress to our families is they have to have established a yes, no, maybe system.
Mm-hmm.
And if their loved one is not communicative, and I say put it on a piece of paper and put it above their bed or put it above their recliner, so that if a first responder comes in, they
Yes,
know how to communicate with the individual.
absolutely.
Personally, I'm not a fan of blinks because sometimes I miss the blink. So I'll give
Exactly.
them
Yeah.
physical cues. Look this way for
This way,
yes,
this
look
way.
this way
Yes.
for it, and
Yep.
maybe. And
Yes.
we put it on a piece of paper so that, say you have home health aides and your aide calls out sick and you get a stranger, and
You need to know what.
you need to know how to communicate with them. And if that's not clear, what the aide is going to end up doing is going to the caregiver. What does he need? No, you need
Exactly.
to be able to talk to the person you're there. And that technique is also good. And I can't stress this enough. If you end up in the emergency room,
Yes.
okay, you're probably not going to have your communication device in the
Exactly.
emergency room. So the ER needs to know how to communicate with you. I'm going a little off subject, but I often tell people keep a go bag by the front door or the side door, whatever you're leaving. And in that go bag should be crucial instructions for first responders and the emergency personnel, how to communicate with you. Other things, don't lie me flat.
Mm-hmm.
I have a feeding tube. Don't put anything in my mouth. Those kind of things which need to be conveyed in the event of an emergency. And one of them would be how you communicate yes, no, maybe.
Exactly. Yeah.
Because if the ER doctor doesn't know, then
They might do something that's not, yeah, or not get the right answer from the person, and things get thrown off. And yeah,
right.
we do. That's, I mean, honestly, from Lisa, one of the biggest things from you that I've learned is having that bag, having something. And we tell people, even on your refrigerator, have this bright colored highlighted that if emergency responders have to come in, or right on the back of the front door, or something that has that crucial information for
Yes.
you.
And the other piece of crucial information that I convey is if you have slurred speech, but that's really your only problem and you're still driving, please have something from your physician in your glove compartment that says you're not drunk. Because in my 30 years here, have I heard of people being arrested? Yes. Because they sound drunk.
Yeah. Yeah, absolutely. We always will use like the wallet cards or something signed from our physicians that say, this is how my speech is. I'm not intoxicated. This is just because, again, hopefully that never happens, but if it does, it's better to have that insurance policy, again, that it's there.
And one of our local people with ALS, she has started Wendy's 911. The purpose of that is to educate people, police officers, first responders about ALS, especially if somebody has slurred speech. And I believe it's called the Blue Envelope Project, and it's really more of an autism related thing. But if you have a
I've
blue
seen that.
envelope and you hand it to the police, they know that
Yes.
you have a special need.
Yes.
Yeah.
Yeah.
So that is something that we consider. So all in all, what we're saying is have a primary form of communication, but also always have a secondary. Because Amanda, you just said it, your power can go out. We live in crazy weather climate times. Some people are without power for days on end, and a communication device only has so much of a battery life. And if you don't have a generator, which by the way is a whole nother podcast, then you have to rely on a backup system. And I'm thinking of those that were just impacted by Hurricane Melissa. A lot of people in Jamaica ended up in shelters. Again, that's a place where you're going to have a secondary system of communication. So it really is truly important to just not, as they say, put all your eggs in one basket. Have multiple baskets around with communication.
All different baskets. Yes.
Yes, yes. And I wanted to ask you also, because I mentioned when we were talking earlier, I saw a TikTok last night of somebody talking about Nuedexta. And can you talk a little bit about what is Nuedexta? Is it, I've heard people say it's improving their speech. I don't know.
Sure. Yeah. So Nuedexta primarily is used for the pseudobulbar affect, so that uncontrollable laughing cry. It's to help regulate. But there has been some research and studies over the past, I think the first one I saw was probably a good about like 7-8 years ago now, of that it's the goal with it potentially is to also help improve speech quality, that dysarthria, that slurred speech, any changes in someone's speech. So we do have some patients who are on it and who have felt some improvement. And that being said, I think it's still pretty case by case for the majority of our patients that have been on it. But yeah, definitely some research out there that it is the goal with it is to help from the emotional standpoint, but then also they've been finding benefits from a speech improvement as well.
Okay. So you mentioned pseudobulbar affect. Can you expand on that a little more? I don't think
Sure.
some
Yeah.
people don't understand, like they'll start laughing and they don't know why.
Yeah. So yeah, with ALS, it can happen that there's in a situation that maybe isn't funny or isn't sad or it's that emotion that is hard to control too. So someone might start feeling they're crying and it's just not at the time when we normally would, or the laughing where it's a situation that maybe isn't as comical as we would normally expect it to be, but it's that impact of our brain saying, I can't shut this off, kind of. It's there. I keep laughing, I keep crying. So certain medications can help with that to see if that
So
works.
it's not something the person can just turn off.
Exactly. Nope.
Um, and problematic with pseudobulbar affect is that if the person is getting really emotionally upset and they're trying to communicate, their voice is even going to be worse. So as a caregiver or as an aide, you need to say, we're going to take a step back. I'm going to let you be.
Yes.
Because it's going to be no good to try to communicate with someone who is that emotionally upset.
There's more frustration than it spirals downward with that.
Absolutely. And it's just going to make everyone more upset.
Exactly. Yeah. Taking that breath, whether it's 30 seconds, 5 minutes, whatever it may be, of just letting everything kind of quiet down and then go back into whatever communication mode that
Yeah.
yeah.
One of the strategies that I've used for years, 'cause when I first started, it was really hard to tell someone I didn't understand you. So not that I would pretend, but I would hear what the beginning, and then I missed a word, and then I've lost everything. And so one of the things that when I first started, somebody said is repeat what you heard them say.
Uh-huh.
Okay. Okay, Mr. Smith, I heard you say you have clinic, but what day? So they're not taking a deep breath again and trying to,
Redoing the whole thing again and
yes,
mhm.
because one of the things that we talk about is energy conservation. And every time somebody has to take a breath and repeat what they've said,
Yep. Absolutely.
so that is a great compensatory strategy. It also alleviates the uncomfortableness of
Yes.
people that come into a house where the person is struggling to communicate. And if you just educate these people, just repeat what you heard them say, it takes the onus off of the listener of going, yeah, I understood. No, I didn't understand.
Yes. Yeah. Yeah. And I think that that's natural too. I think even as a therapist still and doing this for years, our human instinct still is to, oh yeah, guess a little bit of what they, or try to piece it together, right? And having that repetition of from the caregiver side of it to confirm, and I think that makes the patient feel better too. Like, okay, yeah, they got it. They understood it. Something I will tell people as well, and more so their caregivers, is because there's that frustration that comes along with, okay, I've had to repeat myself 2 times, 3 times, 4 times. Like, okay, if after we get to a certain amount of times that we're repeating, and that's different for everyone in every situation, but maybe after the second time or third time, we try something different. We try writing it, we try spelling, we try some other communication mode, or even the topic, just getting the topic out. And then that lets everyone's ears perk up a little bit more to, okay, yeah, we're in that topic of the rain we're having today or whatever it may be. So, but yeah, because it's exhausting. It's really tiring to do those strategies all the time and to making sure you're being heard. And, we always talk that energy conservation piece and, what do we want our energy for every day? And yeah, communication is huge. But if we can save some energy with that and not needing to repeat half of the time at home. That might give us some more energy for movement, for swallowing, for all these other things that we need as well.
And by putting a time limit on it, like I'm going to say 2 times or 3 times, because inevitably what will happen is the person that's communicating will go, never mind. No, and if it was that important that you wanted to use your energy to convey something to me, I don't want
Exactly.
to hear the never mind.
Hmm. Yeah.
So like you, I say 2 or 3 times, and But what you said a few minutes ago just raised an issue with me, is that some people don't mind if you try guessing. Some
Hmm.
people do.
Yes.
There is etiquette
Yes.
involved.
There is. Yes.
Don't assume that you can guess or talk for the person. You need to ask them how they want to communicate.
Absolutely.
And that's important too when you're walking into the home or you're meeting somebody with ALS. Don't just look at the caregiver.
Hmm.
Acknowledge the person first and then say, how do you want me to communicate with you?
Yeah. And so I think it's split, right? For our clinic is we have patients who will say, fill in for me. If you know what I want, that might save me time. It might save me energy. But on the other hand, I have a lot of people who it's still their voice. They want to be that full statement, that full expression out, and both are okay. It's yeah, acknowledging that and I think having that conversation at different times with the patient too is important, of how they feel and how they would want to communicate with.
So we've talked a lot of different issues here.
Yes.
One of the takeaways that I want to stress to those that are listening and viewing is that you need the intervention of professionals before you start purchasing things, especially when it comes to communication, because maybe there is a reading issue, maybe there's a language issue or an access issue, and what you don't want is to spend money on something and go, it's not working. So you really do need the intervention, not just when it comes to assistive technology, but also when it comes to communication issues. And seek out a speech language pathologist. If somebody can't come to clinic, you still can see them virtually most of the time, correct?
Absolutely.
And so it is important to get professional intervention. If you don't go to an ALS clinic, because there are some people who can't, you certainly can still seek out a speech language pathologist, either through a home health agency or maybe your doctor, but don't skip this important piece.
Absolutely. Yeah. Yeah. And it's so critical. And seeing we have every speech therapist and different apps, different tools, different things, and to see a lot of things and talk through what would benefit, maybe not benefit, needs to happen before anything is purchased or loaned or anything, just to get a clear picture.
Absolutely. Amanda, if somebody wants to get a hold of you, can you give us your email?
Absolutely, sure. So it is my first and last name. It's Amanda, and then period, CUTH at jefferson.edu is my work email. Anyone is welcome to email anytime with any questions, and happy to chat.
Well, I really, really appreciate your time today, Amanda. Thank you so
Thanks,
much for
Alisa.
doing this.
Of course, appreciate it.